My question is about the lack of accurate data surrounding daily case numbers. I understand that the main indicator you're looking at is hospitalizations, but don't daily case numbers give you an idea of where those hospitalizations are headed?
Yeah, but that's what Dr. Arruda said, and I think it's important to answer that very quickly. Yes, because of the number of cases, is not as precise as before because they are so rapid tests and they are not being published by the patients. But the good news is we have a very good idea of what's happening in terms of hospitalization and with intensive care. If you look at the intensive care, the way they have been growing in the last few weeks is not as intensive, if I may use this pun, to say that, yes, the hospitalization went up quite drastically, but the intensive care have been with minimal impact. That's the good news. And that's the reason when Dr. Arruda said we're following mostly hospitalization and intensive care, we are still in a good number, especially when we need to eliminate the people that are coming in the hospital, not for a COVID reason, but for other reasons. So we are working on that to make sure that we know exactly what is the trend. But right now, we are still in a good situation.
Obviously, with home rapid tests, there are a certain amount of positive cases that aren't being reported. Do we know how many positive cases do we estimate are missing from that total because of rapid tests that were done at home?
No, we don't. We don't. That's the disadvantage. We'll try to find ways to measure it, but right now the priority was to provide those tests to the population. The way we see the number of tests that have been taken in the pharmacies and the drugstores, we know they're being used a lot. That's good news, but we don't have an approximate numbers of those that are not counted in our daily routine.
Given the high number of cases and how hard it is to track the positive cases, are we in a situation now where we are going to be looking at hospitalizations and deaths as a metric of how serious the pandemic is, as opposed to daily case counts?
That's exactly the thing, because actually, we know this is a very, very transmissible virus. Even if you get two doses, you are protected against going to the hospital and that, but you can transmit the disease. So what is important actually is to make sure that we get the capacity in our healthcare system, so the number of hospitalizations and deaths are going to be a better indicator, and especially also the number of hospitalizations in intensive care and how many people needs ventilation and those things. So I think it's going to be really the fact, and it's why even if we add more tests, rapid tests is not getting into the count. What we're looking and what is important is hospitalization and deaths and hospitalization.